dental office, we always try to run on schedule. However, many times we tend to fall behind schedule, not because of anything that happens with us, but it happens with the patients. Patients tend to run behind. Now, I'm going to give you a couple tips and tricks of how to handle them. My first thing is if you've got a patient who chronically runs behind, and you probably will start to discover them or already know who they are, they always come 10 minutes late. They're always stuck in traffic. They always have a meeting to go to. Then from here forward, whatever time their appointment is, tell them it's 10 or 15 minutes before that. That's how you're going to solve having the patient who always runs late show up late. So if his appointment's at 4, we have a patient like that, he's a real estate agent, he's always 10 minutes late. So now we tell him his appointment's always at 3:45. Then when he walks in and says, sorry, I'm late, we're already ready for him because we knew he was gonna be late. So that's how you handle the chronic patients. But there's gonna be scenarios where patients run late for various different reasons, traffic or their kids or, a meeting at work or whatever. What you need to determine is, what do you do when a patient runs late? You need to have a policy. You need to have something that your staff agrees on or that your doctor wants you to follow. Because what you don't want to do is when a patient runs late and you're not sure whether or not they can be seen, is to spend, as soon as the patient shows up, to spend 5 or 10 minutes deciding whether or not you're going to be able to see the patient. So if you don't have a policy already written up, get with your office manager or get with your doctor and find out what he or she wants the policy to be. In our office, our policy is if the patient shows up, when they show up, if the clinician who's seeing them still feels that they can get the treatment done in the time that's left, then we'll see the patient. However, if the patient's too late and they can't get it done because they're 20 minutes late to an hour prophy or something like that, then we'll reschedule the patient. So the first step is to know whether or not you're going to see the patient or reschedule the patient. Next is when the patient calls you, hopefully they call you to tell you they're running late. Find out realistically how far behind they're running. If they're, ask them where they are. If they're in a town 20 minutes away and they say they're going to be 5 minutes late, you probably want to talk to them at that point and go, there's a good chance we're not going to be able to see you today because you're at least 20 minutes away. So you want to find out more information from the patient when they call in about why are they late, how far are they, what's the scenario going on, because everybody thinks they're 5 minutes away, but if it's 10, 15, 20 minutes away, maybe you're not going to be able to see the patient. The next thing you want to do is then you want to determine when the patient shows up, are you going to reschedule them or not, and be prepared for that. So if the patient tells you, they're going to be 10 minutes late and they walk in 30 minutes later, well, then you needed to be prepared to possibly reschedule the patient. So there's 3 different scenarios that I'm going to give you. One is going to show you, or that I'm going to show you soon. One of them is going to show you when a patient runs late, how to handle it if we're still going to see the patient. If the patient runs in and they're 5 or 10 minutes late and they're really sorry and we can still see them, we want to, get the patient back as soon as possible because the clinician's waiting and we're already behind schedule. But we also want to make sure that the patient understands that in the future we really need you to show up on time. And most patients understand. They understand, we have a schedule and appointments and all that, and most people are good about that. But then you've got the patient who might not fully understand, who thinks they still should be seen, or maybe that you just need to reschedule because they're running late. So then you have to be prepared to handle that patient, to get them rescheduled. And then again, very clearly let them know that we need them to run on time because we can't keep rescheduling you if you're continually running late. We want to make sure that, we have good control in our schedule and that our patients show up at the appointment time that we ask them to show up. So then you have to be prepared to potentially reschedule that patient. And then the last scenario that I'm going to show you, and it probably happens in your office, it happens in our office usually on a daily basis, is the patient who's running late and they run in the door and they feel really bad or whatever, and then they say, but can I go to the bathroom? I need to brush my teeth. Or can I make a cup of coffee? And you're thinking, you're 10 minutes late already. No, you can't have a cup of coffee. No, wait to go to the bathroom after. But you can't do that. Well, maybe the coffee, but you can't, you got to let the patient, brush their teeth or whatever. But you still need to set up clear expectations for the patient because they might think, oh, I've got plenty of time and I can check my text and I can do other stuff when we're waiting to get them back. So as the front desk employee who handles the phones and handles the patients as they arrive, you need to make sure that you know exactly what you're supposed to do with that patient when they arrive because time is urgent. And if you're trying to figure out what to do and you don't know whether we're going to see them or not, we're wasting, valuable time to potentially see the patient. And then lastly, when it comes to patients running late, You also need to have a policy or know who is going to be the person responsible for watching the clock to see if the patient's running late. Because you might have, let's say, the hygienist who's paying attention to their schedule, and they're the ones who let you know, hey, is my patient here? Could you call them? Or maybe you're the one responsible at the front desk. You're watching the schedule and a patient's 5 or 10 minutes late. You call them to find out. It doesn't really matter who is responsible, but somebody needs to be, because the worst thing that can happen is the hygienist is busy putting in their notes. You're busy on the phone with an insurance company. The doctor's busy, with a patient, and nobody realizes that Mrs. Jones is running 10, 15, 20 minutes late. So it's important that you have one person who's responsible to watch the schedule, and then you decide as an office, or you decide when is the patient going to get a phone call. In our office, if they're about 5 minutes late, we give them a phone call to figure out where they are. And that's when we're on the phone to determine whether or not we're going to be able to see them. So make sure somebody's responsible for watching the clock. Know how you're going to handle the patient over the phone, and how you're going to handle the patient when they arrive to the appointment, if they arrive. So I'm going to give you 3 scenarios to watch here. One is where we're going to see the patient, but we're going to make sure it's very clear what next time we need them to show up on time. The next one's going to be the patient who runs late, and we're going to reschedule them. And then lastly, the patient who runs late, but of course has to use the restroom, and how we're going to handle that with that patient. So watch these examples. If you don't know your policies or have a policy, figure it out, and then you'll have better luck with handling those late patients, because we all know we're going to have them on a regular basis.
I'm so sorry I'm late. Traffic was a nightmare on the 15.
Okay, well, you're a couple minutes late. I've talked to the hygienist. She's ready for you. So just have a seat, and she'll be right out. But in the future, of course, we'd like you to be here on time.
Of course, I totally understand. Thank you so much for being accommodating.
Sure.
I didn't tell you yet. It was the cutest thing. We had our 6-month anniversary, our month anniversary, and we went to the puppy adoption. So I gotta go. Okay, I'll call you later. Okay, love you. Bye. Hi.
Hi, Danny. How are you?
I'm good. How are you?
I'm good. Hey, look, we need to reschedule your appointment. I know you called and said you were going to be about 5 minutes late, but now it's more like 25 minutes late, and we just...
Yeah, but that wasn't really my fault, because I had, traffic, my boss, and everything,
Well, I understand things happen, but we can't see you. We're going to have to reschedule, but we're going to need you to make it on time next time.
Okay.
Okay? Okay. When can you come in next? How about next Wednesday at 1 o'clock? Will that be good?
I think I can make that work. You guys will email me though this time, or
we're going to call you, and we will call you on that day and remind you, and we need you to be here on time.
Okay, I'll be here on time next time.
Okay, great.
Thank you very much. Okay, oh my gosh, I'm so sorry. I know I'm late. Hi.
Okay, we are ready to see you.
Okay. But I really have to use the restroom really quick. I know, I'll be really quick.
Okay, but we're running about 10 minutes behind, so be really quick. Rebecca's ready for you right away, okay?
Okay, tell her I'll be right out.
Okay.